I am here to talk to you today about how to safely treat knee injuries and minimize damage. Whether it's a fall, a car accident, or a sprain from playing sports, a knee injury can be very painful and lead to ongoing problems such as chronic pain, difficulty bending, problems with weight bearing, locking of the knee, and instability. I'm going to explain a few steps to take as soon as possible after the injury occurs in order to minimize damage and pain. If you have a sprain or a strain injury, you're going to use the acronym RICE, which stands for Rest, Ice, Compression, and Elevation. If you think you have a ligament tear, you want to mobilize your knee immediately. That means keep your knee as stable as possible and don't put any weight on it. If you suffer from chronic inflammation or bursitis, you are going to want to ice your knee 20 minutes on, 20 minutes off. You can also use a TENS unit if you have one of those. And then you are going to want to see your pain specialist for cortisone injections or any type of trigger point injections. If you have a more extensive injury such as a ligament tear, a fracture, or instability, that may require a referral to an orthopedic consultation. You should see a pain specialist whether the pain is from a trauma, from a slip and fall, or a car accident. And at Pain Stop, we have multiple methods to treat knee pain, such as digital x-ray, diagnostic ultrasound, which helps to diagnose and treat the problems of the knee. Check out our blog for more information on different types of knee injuries and treatment. And remember, your pain stops here.